Good day to you. This is Norman Morris from Cornerstone Senior Services out of the Asheville, Western North Carolina area. I am an insurance agent and I work with people to help them figure out their Medicare, basically how to maneuver the Medicare Maze. All right. So when you're getting ready to sign up for Medicare, you are bombarded with information about Medicare. You are receiving emails, you're receiving postcards, you're receiving letters. You may even have people knocking on your door trying to sign you up for a Medicare plan. So it can be very confusing, and so I've created a few videos to help you understand what your options are with Medicare and to get everything that you deserve with Medicare. All right. I tell people this is that when you are working and you're paying taxes for your Medicare and paying into the system, the government never missed a payment. They never said, okay, Norm, it's been a rough week for you financially. I'm not gonna make you pay taxes this week. We'll just go next week. All right. No, they made you pay every single week. All right. And so basically you paid in the system and now you need to get whatever you deserve out from the system. All right. So that is what my goal is to educate you and to help you get everything you're entitled to. Now, before we begin and talk about Medicare, there's a difference between Medicare and Medicaid. Medicare is the national health program that covers everyone nationally. That's what we're focusing on. Medicaid is the state-by-state program that helps people who are financially struggling. All right. So sometimes they do work together, but our focus for these videos is going to be on Medicare. All right. So today we're going to talk about the parts of Medicare. And there are 4 parts, very easy if you know your ABCs. There's Part A, Part B, Part C, and Part D. Part A is the hospitalization. This is the part that usually does not have a premium. It's usually a $0 premium, but there are some exceptions. But as long as you've worked 10 years or 40 quarters, for the most part, it's going to be a $0 premium. Again, some exceptions, and you can give me a call and we can talk about if there's an exception for you. This has a $1,484 deductible. What that means is when you go to the hospital, that's the part that you have to pay first before Medicare takes over. All right. Part B is the doctors and medical. This is the 80-20 plan. Medicare is an 80-20 insurance plan. A lot of you, when you were working, had like a 70-30, a 90-10, 80-20. All right. What this means is Medicare pays for 80% of your doctors and medical procedures. You are responsible for 20%. There is no cap on that 20%. So if you have $100,000 worth of medical bills and all you have is Medicare only, you're responsible for $20,000 of that. All right. Medicare Part B has a deductible of $203 a year. As of 2021, it's slowly increased. During 2020, it was $198. It increased to $203 this year. And it also has a premium. Again, there are exceptions for people based upon your income, and we can talk about that as on a case-by-case basis. But for the most part, the premium is $148.50 this year. This does increase every year depending on whether you've got an increase in Social Security or not. So if you have a year where you did not get an increase in your Social Security, your premium will not increase. But even if it increases just the slightest amount, Medicare Part B premium will increase. All right. Part C is known as the Medicare Advantage. This is the quote-unquote all-in-one card. And you've seen these ads all the time. Joe Namath has been real popular doing that this year. But that's a whole different ballgame. We will talk a little bit later about that in one of my next videos. Or rather, one of my later videos. The final part, Part D, is a drug plan. And that's easy to remember. D stands for drug plan, prescription drug plan. And this is a very important part. This helps cover your prescriptions. And I'll have a separate video on that as well. But you need to have a Part D. If you do not, you'll receive a penalty, and it's a lifetime penalty in regards to that as well. So even if you don't take any prescriptions, I do recommend that you get at least something to cover your drug plan or something similar to that. All right. So those are the 4 parts of Medicare. Hopefully, if you did not know, that gives you an idea of what they are. And so when you hear people talking about parts of Medicare, that's what they're talking about. All right. I appreciate your time. Thank you so much for joining me, and I look forward to talking to you soon. Take care.